For expectant Black mothers, death surrounding childbirth remains too high and healthcare is sought too late.
Dr. Twin Green, founder and president of the Link and Option Center, joining us now to break down the maternal health crisis affecting so many. Thank you so much for joining us.
Thank you for having me.
Can you talk a little about the numbers, the disparity that you're seeing out there, and why it's so important that we listen?
Absolutely. The disparities, especially in South suburban Cook County, are the numbers are just way too high. They're 21.9% of teenage pregnancies, which is above the national average. We have 15 to 19-year-olds that are pregnant and not receiving care as they should, too late. And then we have mothers, adult women, that are also either having prenatal care after their third month of pregnancy. After third month of pregnancy, or they're not getting it at all. And that is a problem. And that is a huge problem.
And then that only contributes to the mortality, because those numbers are shockingly high. Black women almost 6 times more likely to die within 1 year of pregnancy.
Yes, yes. And 88 women a year
in the state of Illinois.
Absolutely, in the state of Illinois, die from complications that could be prevented.
In 2025, we are still talking about these numbers.
Absolutely. And so why are women still dying when we know that it could be prevented?
Why?
That's the problem.
And then what's the answer?
And the answer is we need to come outside of our brick and mortar model, go into the maternal deserts where people live right now, and they will come to a visible mobile health unit. We cannot continue to have the same recipe and expect a different result.
You talked very briefly about a desert, as well as the solution, and that's becoming more mobile. Can you go into a little bit more detail?
The desert is that there aren't enough providers even knowledgeable about where the people are that are not receiving this care. Or if they are, they're not touching them. So we have that solution. We've been in business for 30 years.
The Link.
The Link and Option Center for 30 years. We're a legacy agency, healthcare agency. And we know that this crisis is something, the data tells us this. Our health department has put this information out for us to see. And there have been recommendations over and over, but recommendations take time to make change. But time will save lives, will not save those lives.
So last week you called a press conference along with some other elected officials out in the south suburbs to bring attention to this.
I did, because it was an alarm that needed to be heard. Legislators are right now in Springfield passing budgets for numerous important issues that we have, but this particular maternal health crisis is it hits home. Having a child should not be a fatality. Giving birth should never be that.
So the providers, the doctors, they're just not in the area where everyone needs help. So you're helping to get a mobile clinic to those folks. But it costs. It costs money.
It costs about $700,000, which is a drop in the bucket for saving lives. $700,000. And if we can get that, we can have this stood up in 6 months with a professional medical team to go out in the community and travel to those deserts where we know that those people are.
So you're talking about 1 unit, 2 units, how many units?
Well, that's for one.
Just for one?
Yes, but who knows? We can get a fleet.
And so $700,000 we hear is the price tag on that.
Yes.
There's some lawmakers talking about maybe making that happen. Where are we right now?
Yeah, well, we're waiting to see. The budget should be passed. We have a deadline of the end of May, so we're hoping that will materialize. But we don't stop with the state. We have the county that we can also rely on. We have other people that would love to make donations for this cause. So money doesn't have to just come from one place, it can come from many, but we know that the state of Illinois has a responsibility to save lives.
And if nothing is done?
Then we will continue to see women die when they shouldn't, and it could be prevented.
All right.
And that's unacceptable.
Dr. Link, thank you for coming in and shining a light. Dr. Green, I called you Dr. Link. Dr. Green, thank you for coming in and shining a light on this situation.
Thank you for having me.
Thank you. For more information, visit link-option.com.